Hello friends, I am Dr. Aditya Borawake and I am working as a consultant gastroenterologist and hepatologist at Manipal Hospital Kharadi, Pune. Today I am going to speak with you regarding a very important and common disease that we see in our day-to-day practice, that is acute pancreatitis. So what is acute pancreatitis? Basically, there is inflammation around the pancreas. So in simple terms, that is what is acute pancreatitis. Now coming to the causes of acute pancreatitis, the two most important causes are gallstones and alcohol. 90% of the cases of acute pancreatitis are related to either gallstones or alcohol. Now there are some other causes also, like increased calcium levels in the blood, that is hypercalcemia, increased triglyceride levels in the blood, that is hypertriglyceridemia, local trauma to the abdomen can also cause pancreatitis. Then other rare causes are genetic causes, pancreas divisum, especially in children, etc. So all these are the causes of acute pancreatitis. Now coming to the symptoms. The most important symptom of acute pancreatitis is abdominal pain. So how this abdominal pain goes in cases of acute pancreatitis? The abdominal pain typically starts suddenly. This pain is extremely severe. It is more in the epigastric region, that is just below your chest region. This pain often radiates to the back. Sometimes it also radiates towards your shoulders. This pain starts suddenly and it goes on increasing in intensity with time. Apart from abdominal pain, the other important symptoms are nausea, that is sensation of vomiting, and sometimes the patients also can have vomiting and low-grade fever. So the important thing is, whenever you have any of these symptoms, you have to consult your gastroenterologist at the earliest. Now coming to the diagnosis of acute pancreatitis. So there are three criteria. One is clinical. So as I said, in clinical symptoms, the most important thing is abdominal pain that I described some time back. The other important things are radiological and biochemical. So in the radiological diagnosis of pancreatitis, USG, that is sonography of the abdomen, and CT scan of the abdomen. These two are the important investigations that we should do. The third is, as I said, biochemical diagnosis. So in biochemical diagnosis, basically we see the blood test. In blood tests, the important enzymes that we need to see are amylase and lipase. So if amylase and lipase levels are significantly elevated, especially more than 3 times the upper limit of normal, it suggests acute pancreatitis. So the diagnosis of acute pancreatitis is made on these three criteria, that is clinical, biochemical and radiological. Now coming to the treatment of acute pancreatitis. The most important treatment or most important thing to be done in acute pancreatitis is we should not give anything to the patient orally, because the pancreas need to take total rest. That is the reason why any food or water, that is solid or liquid diet, should not be given orally. Another important aspect is we have to give painkillers. Now most of the patients require IV painkillers. Other important thing is we have to hydrate the patients properly, that is IV hydration is required. So this is how the pancreatitis case is managed. Now coming to the complications of acute pancreatitis. The most important complication is many patients develop peripancreatic collections. So if the patients develop peripancreatic collections, there are certain procedures that we have to do, like EUS guided drainage of these pancreatic cysts or these pancreatic collections. Thank you.